What duration how long can you use this thing?
The erection will stay up as long as you want it to. So
Until your thing falls off?
it won't fall off. You keep it on, usually within less than an hour, people are done and their partner's done, and then they deflate it. And you can use it again and again for your entire life, assuming the device doesn't have any sort of malfunction down the line.
So I can use it all night?
Well,
Continuously?
Well, you
What if
could
I have
have
multiple partners?
If you had multiple partners, you could use it. There's no time limit. I mean, I wouldn't recommend like falling asleep with it up or leaving it up for more than a few hours. You're going to be exhausted at that point anyways if you're actually using it. But no, there's no time limit. If you were to fall asleep with it up, it does leave a constant pressure there, and it could lead to an erosion.
How long is the surgery?
Usually 1 to 2 hours, depending on your anatomy and your surgical history.
Does insurance cover this?
Yes, almost always.
Really?
Yeah. This is actually surprisingly common. And probably a lot of people have one and they've never told you.
Well, I wasn't really looking. Unless I stick to my own sex. I mean, my own male, female.
Got it.
I don't cross over.
Got it.
But I know the ladies like to be, my wife's considerably younger, and she likes to be a little active in bed, and it seems like I'm deflated nowadays.
Okay. Well, it's definitely something.
Is that the best option, inflatable?
That is sort of the gold standard, the one that has the best results. It's automatic. You get a rigid erection when you want one, and it can be totally flaccid when you don't want one.
How long is the surgery?
Right, it only takes 1 to 2 hours. The other one, the malleable prosthesis, is much simpler to implant surgically. Should be like 30 minutes because there's really no fluid. There's not a dynamic system. It's just these sort of semi-rigid rods that are implanted into the penis. And so when you want to have an erection, you just straighten the rods, and then when you don't want to have an erection, you just fold the rods. So it's not as rigid when you want it to be rigid, and it's not totally flaccid when you want it to be flaccid. So most people...
There's rods?
Yep, they're basically implanted into the penis are these malleable rods. And they work, but it doesn't have as good a function as the inflatable system. The advantage is that it's simpler to put in.
How do you extend the rods?
You just like you would any sort of malleable device, you just fold it and basically tuck the penis in.
I like the pump option.
Most people prefer the pump option, and in the U.S. it's by far.
There's a little button where you push your belly button.
No, it goes into the scrotum, so right next to the testicles.
It goes in your ball bag.
Yes.
Oh. How many patients have had this done?
Worldwide, thousands of men.
What's the guarantee this is going to work?
Well, obviously nothing's guaranteed. It's a surgery, so there's always risks of surgery. But assuming that there's no surgical complications, which are very rare, it's pretty much 100%.
So I get guaranteed results?
Right. I mean, there's no warranty that you're 100% satisfaction or your money back. But assuming that the surgery goes well and you recover well, then it works 100%.
How would this affect if I'm going to have, because I know I'm getting older, I am older, with prostate, if I have prostate surgery? Is there an interaction with that? Or?
No. If anything, prostate surgeries tend to worsen the erectile function and increase the need for these types of things. But if you were to develop a prostate problem and needed a procedure because of it, this wouldn't prevent you from having that done.